Welcome to Menopause Reimagined. I'm your host, Andrea Donsky. I'm a nutritionist for more than 18 years, and I'm in menopause. I'm a menopause educator, menopause researcher, and I'm the co-founder of wearemorphus.com, a company that helps to empower you to take control of your health and symptoms with nutrition, lifestyle, supplements, and research. Today, I'm speaking with Dr. Fay Weisberg. She's a board-certified obstetrician and gynecologist and an assistant professor at the University of Toronto Department of Obstetrics and Gynecology. She has a passion not only for women's health, but for improving the overall well-being of her patients. Drawn to cutting-edge medicine, Dr. Weisberg has had a busy infertility clinic since 2000 and runs FemRenew, a clinic devoted to vagina, vulvar, and sexual health. Dr. Weisberg is one of the first physicians in Canada to have a laser that treats vaginal dryness in postmenopausal women. She also offers platelet-rich plasma, or PRP treatment, that addresses vaginal dryness, laxity, incontinence, lichen sclerosus, low libido, and infertility. Now, here's Dr. Weisberg. Welcome to Menopause Reimagined, Dr. Weisberg.
Thank you very much for having me, Andrea.
Well, I know we've been talking about this for a long time. So for all of you who are listening, Dr. Weisberg is actually my doctor. And I've known her for over 20 years because Dr. Weisberg helped me get pregnant with my son, who is now 20. So we've known each other for a very long time.
20 years old.
He is 20. So I first met you when I was trying to get pregnant, but then I see you every year. I see you actually quite a bit. So I've known you for a very long time. So I was excited because we've been talking about doing this for a long time. And I know that you have some really cool cutting edge technology and non-hormonal options that you are very much experienced with, and that you're helping women in perimenopause and menopause. So I thought it would be great to have you on the show.
Well, thank you.
So let's get started. Let's talk about the non-hormonal options that we have to help with vaginal health. So we did a podcast not too long ago about vaginal health, and we're going to continue the conversation because it is such a big issue for so many of us in this phase of life. So let's talk about what we can do to help ourselves when it comes to non-hormonal options.
Well, I think the very first thing, and I stress this all the time, is that women need to understand that if they're having problems or discomfort, or they're worried about their vaginal health, they need to go see someone and talk to them. Find a doctor who understands, find a doctor who is willing to have the conversation that you're comfortable with having. And I hear that over and over and over again from my patients. If I only would have known that this was going to happen, or that I could have done something about it. So I think and that's why this podcast is so great, because it will encourage women to realize that whatever they're going through, they're not alone. Go see someone, talk to them. Don't be afraid. There's other things than hormones, but our sexuality and vaginal health and any kind of discomfort that women have is a big part of who we are. And it trickles down into self-esteem and not feeling good, and depression and sadness. And I think that having a safe space, knowing that you have a place to go talk to about it, is really, really important, and not just putting it away. We're not our mothers, or grandmothers. We live a lot of our life through this time, and intimacy and health is really important. So that's sort of and that's how I got into this, because I realized as I was getting older and my patients were getting older, that we needed to talk about this. We needed to look for options that were, not scary and non-hormonal and available, and that really worked.
So what do most of your patients say to you, like when they come to see you, who are in menopause or in this phase of life? Is it libido? Is it vaginal dryness? Is it both? Are there other
everything.
things? Everything.
So I tease it out. Like when patients come in and they talk about menopause, I bring up vaginal health. Patients will talk about vaginal dryness, often, low libido or no libido, itching, abnormal discharge, and a lot of urinary symptoms, pressure in their bladder, constant leaking, feeling like they have to go, and incontinence. So all of that is related to the same problem. The other thing I'm seeing more and more and more of is a skin condition called lichen sclerosus. Women will complain of vaginal itching. They think it's their vagina. It's on the outside. They have tearing, they have cutting, they have bleeding. And it seems like it's more and more of this condition, but I actually think it's just that no one ever spoke about it before.
Can you
So
explain what lichen sclerosus is? Actually, funny enough, a friend of mine, I was just with a friend maybe 3 weeks ago, and she was, she was talking about it. I had heard about it, but I didn't really understand it. It's an autoimmune disorder. I think it's autoimmune, right?
we think it's autoimmune.
Okay. If you can explain what it is, and she was telling me about it, and she was saying how it's so uncomfortable. She's having a difficult time having sex, and it's super painful. So I think it's something that I really want to bring to the forefront. And I know you have a way to help women with it, but just maybe explain what it is.
Sure, lichen sclerosus is a skin condition that's specific to the vulva. It can happen anywhere. So it's not in the vagina, it's on the skin. It could be on the labia. A lot of women have it on the area between the vagina and the rectum or up near the clitoris. It's seen in young girls before puberty, and it's seen in postmenopausal women, and it usually presents with vaginal itching. Now, that being said, I do have a couple of women who are, in their 20s or 30s that have it, but that's pretty rare. We think it's an autoimmune condition, but we don't really know for sure. But it can be terribly uncomfortable, and it can also actually distort the anatomy of the vulva. So women will have phimosis or scarring over their clitoris. The labia or the lips around the vagina can really flatten out and adhere to the skin. So it's uncomfortable, it's disfiguring, and in many women, it's life-changing. Like, they won't see a doctor, they'll see a doctor who doesn't really know what it is, or they don't want the treatment, or there's other things, but it can progress quickly. It may not, but it really is getting very common. And the other thing about lichen sclerosus is that about 10% of women may progress to some form of vulvar cancer with this. So not only do you need to sort of know that it's there, but you need to have a doctor who can sort of see you on a regular basis. Maybe I see my patients every 6 months once they're under control to make sure that things look okay.
And the way that they would get diagnosed with it is through an actual exam, right? Like, so you
Yeah, so there's sort of clear indications of lichen sclerosus. You'll see white patches on the vulva, you'll see itching, you'll see discomfort. Sometimes the actual way to really diagnose is by doing a biopsy. So put a little bit of freezing, and there's this little tiny core of tissue that we take off and send it to the lab. You don't always have to do it. In fact, I often will decide that, to me, it looks clearly like lichen, and I'll treat it, and I'll see back in 5 or 6 weeks. And if it doesn't get better, I will do a biopsy then. So the mainstay treatment with lichen sclerosus is actually a steroid cream, a fairly high potent steroid cream that women put on. In my practice, I use it like 4 times a day, and then I slowly wean it down to a maintenance dose of 2 to 3 times a week. A lot of women don't like taking steroids. A lot of women and pharmacists will tell patients, be careful, this will thin your skin. But you also have to remember that if you're treating abnormal skin, you're not thinning it, you're treating it. So a tiny, tiny dose, a decreasing dose. And I would say that probably in 70 to 80% of women, it actually works. If it's done properly. And the other thing that's really important as we go through menopause, the skin changes, the hair changes, the fat changes. So women are very, very prone to environmental problems with their vulva. So you must stay away from soap. And I tell my patients, even if you think it's not soap, if it's something that goes on the skin, don't use it. So plain water in a cloth, if you have a bidet, but nothing else. Right around the skin of the vagina. You can clean the rectum with soap in the top part, but not around the vagina. And the other thing is, women sometimes will use baby soap thinking it's fine, or baby wipes. And baby wipes are full of chemicals, and they can actually burn the skin. So, I'll tell patients, plain water, pat dry with toilet paper, or use the flushable wet naps to clean. But those can actually cause a lot of vaginal problems or vulvar problems, leading to vulvar pain. Not lichen, but still a big problem.
So, and that goes for everybody, you're saying, like, as you go into menopause, just everybody in terms of not cleaning, like to just use soap, or is it just women who have lichen sclerosus? Just so I'm clear.
No, any woman who's going through menopause. But it just clicked my public service announcement to not use soap.
Got it. So, and what about like the washes that are pH balanced though? Like, what about like, can women use those?
No. There's
Okay.
I've never sort of believed in pH balancing because our body is so amazing to be able to balance everything. You know, we have the good bacteria, we have everything. And even if you have, like, you take antibiotics, I think probiotics are way better to sort of manage the shift in bacteria than the washes are.
Just to recap, what you're saying is as we go into menopause, we really want to be mindful of what we're using to wash in the area, in our vaginal area. So you prefer, if we're going to wash it, then, you're saying our anus and then the inside, I guess, between the area between it, but then not the actual, don't go inside the vagina with any type of soap or any type of wash. Just use water and clean around the area. So that keeps it. Okay. So just to make it sure. Okay.
Okay. Now we go back to Lichen.
Now go back. Okay. Go ahead.
So like the main first treatment would be the steroid cream. I see patients back in 6 weeks. If they're feeling better, then we continue. And sometimes the feeling of improvement does not sort of correspond with what we see on the skin, but that's okay. Skin comes later, the changes. So mainstay would be steroid cream. If the steroid cream doesn't work, I've had patients who've actually seen dermatologists who've given them treatment for psoriasis. That's a non-hormonal cream. In my experience, it doesn't work as well.
Okay.
So if the steroid cream doesn't work, or they're not happy being on the steroid cream for whatever reason, I will do a biopsy. Biopsy takes about 3 weeks or so to come back. If it does confirm lichen, I have two options. One of them that I'm really excited about that's new, and the other one. So if the problem is skin and the skin is thickened and abnormal, I have been using the Mona Lisa laser, which I think you guys have spoken about before.
No, we haven't. We actually haven't. You're the first one we're talking to about it. So that's why I'm excited to learn.
The Mona Lisa laser has two components. One is for vaginal dryness, which we can talk about after, but there is a skin head to the laser that will resurface skin on the outside.
Okay.
So what I'll do is I'll put freezing on the vulva and I will laser the lichen sclerosus that I see. And it's a treatment that takes like literally 3 minutes to do. And doing it every 4 weeks, and it's usually 4 or 5 treatments, and the lichen will, pretty much go, the symptoms will go, and then there's sort of a maintenance dose. So in women who have a little bit more of a superficial lichen, the laser works really nice. The same way that we resurface our face and other parts, it lasers, it resurfaces the lichen.
Interesting. And so that's the laser. You said there were two options. What was the second one?
So the second option that I'm just starting in my office is using a patient's own platelets. So something called PRP or platelet or plasma platelets. So what we do is we take the patient's blood, put it in a centrifuge, and then we take the white portion, which is the platelet-rich plasma. So it's their own blood, activated platelets. We draw it up in a syringe, and then we can inject it into the actual plaques of lichen sclerosus. And then just take a step back, platelets are full of proteins and regenerative cells. They bring in healing factors, fibrogen, collagen, and new blood vessels and new nerve regeneration. So platelet-rich plasma has been around. Patients get it injected into their face to get rid of fine lines, into joint spaces. I actually had PRP in my knee a couple of months ago, and it was unbelievable how it took the pain away. Wow. So now there's a lot of places that we can use it in gynecology and actually fertility.
I had it done on my face. It's like it's the vampire facial, right? That's
so the vampire facial, or you can actually have just even little injections in, and it's amazing how it gets rid of fine lines, and it's the only actual treatment that's so natural. Like there is nothing in it but your own platelets.
I remember when you told me about it in your office, I'm like, so if you go in for vaginal PRP, can we actually do it on our face at the same time? And you were like,
what did I tell you?
You said yes.
Yeah, so actually
2 for 1.
I did get the company that I bought the centrifuge from and the tubes. It's the tubes that are so important for this. A little glass staple kind of, so you could put your PRP, whatever's left over, into that and then just stamp your face.
Do it on your face. I think you get like the 2 for 1 when you do it.
The 2 for 1.
So just so I'm clear, what would be really, so the PRP versus the laser, in what I guess, what would you recommend? You do both in your office?
I do both in my office.
So how do you know how to so again, we talked about lichen, but it's what, like, I guess from a vaginal health perspective, how would you know when to use which
That's a
technology?
great question. So with PRP, you can actually inject it directly into the spot. So if a woman has a lot of lichen sclerosus, I probably would start with a laser and then go to the PRP. Just so what happens when you inject PRP, it sort of stays there and then slowly filters out to heal the tissue.
Okay.
So you sort of, start with the outside, get rid of the first couple layers, and then work in deeper. But what the PRP does, and there's something called an O shot, and it stands for orgasm shot, but it does way more. So it's an injection of PRP that goes into the area between the vagina and the urethra and around the clitoris. So there's 2 injections, painless because you use a lot of ice to freeze. And what the O shot does is it helps with urinary incontinence because we're filling up and bringing in more tissue in the area around the urethra, the tube from the bladder.
Okay.
It helps with vaginal dryness by bringing in new blood vessels and more blood flow to the vagina. It actually helps with vaginal laxity by plumping up the tissues around the vagina. It filters out into the skin, so it helps with lichen sclerosus. And it also helps by the injection in the vagina and around the clitoris, helps with low libido and orgasm. So we know as we get older, sometimes we don't reach orgasm or it takes us way longer to get there. So the O shot will help. So the O shot it's like too good to be true in many ways. It helps with so many of the vaginal and vulvar problems of menopause. It's the one visit. PRP takes about 2 to 3 months to actually start to sort of peak, and it lasts for about a year. So it does a lot of things. If the patient has extensive lichen, I would probably do laser direct injection of the PRP and then maybe the O shot after.
So the O shot, just to be clear, is the same. Excuse me. So the O shot, just to be clear, is the same thing as the laser. Is that synonymous?
No, the laser is the laser. So let's take a step back. The Mona Lisa laser, which I got in my office about 7 or 8 years ago, treats vaginal dryness. It goes directly into the vagina, it also superficially changes the lining of uterus, brings in blood flow and collagen, helps a little bit with bladder infections, incontinence, that feeling of pressure that women get in their bladder. The O shot does laxity. It does those things, but it treats laxity, low libido, orgasm, and lichen.
Okay, so it's 2 different things, but you could use them together. But you could use them.
You can do them together. In fact, you can do the laser and then you can put some PRP directly into the vagina after to help with laxity and to help it work a little bit better. But it doesn't, unless you inject it, it won't help with the lichen sclerosus or the libido or the orgasm.
So really it's 3 different things then. So
yes.
3 different, so 3 different options that you can
get
done.
3 different options. Some of them they overlap, but what's really exciting to me about the PRP is sort of one treatment. It's like natural, and it diffuses into helping so many different things. And women with lichen, Andrea, are so unhappy and miserable. And when you talk to them, I don't want to be on steroids. It hurts my skin. It doesn't work. It's really almost a full-time job to remember 4 times a day for a week, 3 times a day for a week, and then, the maintenance dose. So, and they're unhappy. It's really uncomfortable, and it hurts with intercourse. It causes bleeding and tearing, and that's what led me to the PRP, was looking for ways to treat lichen, because these women are so unhappy and debilitated by this disease.
When my girlfriend who has it was telling me that it really is, it's like has completely, played with her, messed with her sex life, and it's so painful. So, and she was saying that she was going to start hormone replacement therapy. Can HRT or menopause hormone therapy actually help with lichen, or that's not something that would be indicated?
No, I have never actually seen HRT work for lichen. HRT may help with the vaginal dryness part, but it's not going to help with the vulvar part. And estrogen doesn't help. Now, sometimes women who are menopausal, I'll see they have lichen on their labia, but the vulva, like the area between the urethra and the vagina, is so dry. So sometimes I'll give a little bit of estrogen cream for that, but HRT isn't going to help with lichen. And women who have lichen now, like, are vocal, like, help me, they go to the doctors, and a lot of physicians, unfortunately, aren't sort of queued up for it.
Right. I mean, that's yeah. I mean, I'm happy to hear that you're specializing in something like that, because so many women need help. I mean, one of the things I hear so often in our community of women on TikTok and on social media and just from our website is that vaginal health, like their vaginal dryness, it literally does. I was just talking to a woman this morning and she was saying it just has not ruined, but it's put a big, a lot of pressure on her relationship. It's really coming into play in terms of her relationship with her partner. And it's women are looking for help. Like, we need help, so it's 100%. So nice to know.
It's interesting. And I don't want to use, I want to say that, a lot of doctors don't know what they're doing, but they're not, unless you're sort of into treating vaginal health. I mean, you need to examine these women, and so many times you'll find lichen or you'll find something else. But the one thing that I see over and over again is, yes, there might be dryness, and women will complain of sort of this, knife glass shearing pain in their vagina. Yeah. But a lot of times it's actually the entrance to the vagina that's really hard and painful. So not in it, how would we know unless someone sort of touched areas, but it's not inside, it's the entrance to the vagina. And that's related to the soap and the, not washing properly. The entrance to the vagina is called the vestibule, and it's full of glands and nerve endings. And if they get irritated, because it's more exposed when we're menopausal, it becomes excruciating. Like if you go for a pap smear and just putting the speculum in, or someone would have trouble sitting or wearing underwear. But certainly with intercourse, when the penis starts to go in, if it hurts, it's that area. And that has nothing to do with hormones. It has nothing to do with putting someone on vaginal estrogen. It's actually getting rid of the problem, which is talking about no soap and the wipes and all of the other stuff. Okay. And treating that area. And you can treat that area with a little bit of steroid cream, as long as you get rid of the problem, like what's causing it. Steroid cream will take down the inflammation. I have patients using EMLA, the over-the-counter numbing cream.
Yeah.
For intercourse, by getting rid of the pain. And guess what? PRP injection into that area will also heal it.
Is there any, actually, let's talk about pricing. So what does it cost? Like, is it depending on the individual or their standards? So we have the 3 different options that you are providing in your office. What are women looking at in terms of costs?
So the laser for vaginal dryness, it's $2,100, and it's 3 or 4 treatments, 6 weeks apart. So some women don't respond as fast as other women. Often women who have red hair, they just don't, they need sort of an extra boost. So it's 3 or 4 treatments, 6 weeks apart, is $2,100. And I've written letters because the Mona Lisa laser has been approved by Health Canada as a treatment for urogenital atrophy. It's sort of written in the books. I'll write a letter for their insurance company, and often it will be covered.
Oh, and that $2,100 is for all of those treatments. It's not just per treatment. Okay. What about, do you know if it's FDA approved? We have a lot of listeners who are in the US and for all over the world. Really.
I think it is. So I believe it is FDA approved. I think it started in Italy, went to US, and then came to Canada. So I'm pretty sure it's FDA approved.
Amazing. Okay. So $2,100 for the 3 or 4 treatments.
And then there's a maintenance. So I have patients who use it for frequent bladder infections, come back every 6 months. Women who use it for vaginal dryness tend to come back when it's dry again, which is any time between 9 months to a year. And the top ups are $500.
And then for the O-shot?
The O-shot is $1,500, and it's 1 treatment.
Okay. And how long does that last? Like how long is that? A year.
About a year.
Okay.
If we're doing injections of PRP for lichen, it's 3 treatments that are 1 month apart, and it is $500 a treatment.
Mm-hmm. Your actual treatment. Okay.
Yeah. And same if I inject it for the vulva, for the vestibulitis, or the inflammation at the entrance to the vagina.
Let's talk about UTIs for a minute, because you said a lot of, you're talking about how these can help, this technology or these treatments can help with UTIs. explain what happens. Why are we more prone to getting UTIs as we go into perimenopause and menopause? And how do these treatments, how is it helping? And because, and the reason I'm asking too is that my mom is having a lot of UTIs and a lot more frequently.
Right.
And she keeps having to go on antibiotics, and the antibiotics is just messing with her body. Like, so, and it's not a long-term, like I keep telling my mom, if you're getting these every, few months, going on antibiotics every few months, I mean, it's just not, I mean, we love antibiotics, but not to be going on it all the time, right? Several times a year. So explain what that is and how that can help, because I definitely want to recommend it to my mom.
Okay, so the first thing I'm going to tell you is that if women get frequent UTIs, they probably should see their physician and make sure they don't have something like kidney stones or any kind of stones, because stones, being there are always a source of infection, and that's what needs to be treated as opposed to anything else. So it's really important just to make sure that there's nothing pathological going on. But what happens as we go through menopause and we lose estrogen, what tissues are estrogen dependent? Well, yes, we know the vagina is, but the base of the bladder is also estrogen dependent. And if you think anatomically, if this is the vagina here, the bladder sits right on top. So the base of the bladder is estrogen dependent. And if there's no estrogen, the skin is different and it doesn't have protection. But the urethra, or the tube that takes the urine out, is also estrogen dependent. So it loses its thickness. And if it loses its thickness, it loses its protection for bacteria coming into the bladder. And once the bacteria come into the bladder is sitting duck for infection because the base of the bladder can't protect it.
Right.
So it's related to it. And the reason that the laser works is because the base of the bladder and the urethra are also treated. So the laser will bring in blood flow and collagen and thickness and help with that. Now, let's not forget our friend estrogen, because local estrogen to the vagina will also help with frequent bladder infections and vaginal dryness and all the menopausal things. So there's two products. I always tell patients, well, I don't recommend using estrogen cream, because estrogen cream will get absorbed and be like hormone replacement therapy. But there is a product called Vagifem, which is a little tablet that gets injected into the vagina with an applicator. It sits in the vagina and it gets absorbed, and it can protect the vagina as well as the bladder. And there's also a ring, a plastic ring called Estrogen, that goes into the vagina and sits there for 3 months and also protects. For some women, it's not enough, but I think it's a good start, especially because the prices for everything else is sometimes prohibitive. And the product monograph for Vagifem is like every night for 2 weeks and then twice a week. But because it's such a low dose of estrogen, I have some patients who I say, just use it Monday to Friday, take the weekend off. And it's very, very safe. It gives more estrogen. And in a lot of women, works very well for bladder infections and vaginal dryness. But bladder infections are really serious as women get older. Like, we can't poo-poo it, because it can result in sort of silent sepsis. So women that are older don't always have their body can't always respond appropriately to infection, and it can actually be quite serious. So it's really important to look for pathology. Why am I having bladder infections? And an ultrasound that looks at the kidneys, looks at the bladder inside to make sure there's nothing else there is first line for me.
No, that's great information. And the thing about UTIs too is I find that as we go into perimenopause and menopause is the sensations are different, like you talked about before. So you may not have the same symptoms. Like, it happened to me recently where I had a bladder infection, but it didn't present the same way it did prior to me being in menopause. And I used to get stomach aches, or I'd have burning when I peed. I had none of that. The only reason I knew I had it was because I had memory loss. And I remember learning like a long time ago that there's a connection between older people and UTIs and memory loss. And I was like, and it was so significant, the memory loss. I'm like, what is going on?
That's
like, it was
fascinating. My mother actually went into septic shock from a bladder infection.
Wow. Yeah, no, it is so serious. I actually tell women all the time, like, you need to be doing those home test strips once a month, and then obviously go get it confirmed from your doctor. Like, if you actually see a change on those test strips, it is one of the things that it is so important. So I'm so happy you mentioned it, because it is so important as we get into this phase of life to keep a handle on UTIs and making sure that you don't have one. So I think that's great information. Is there anything else around, before we move on to another topic, around the lasers, the O-shot or the PRP that we didn't mention that you want to mention?
No, I think I go back to not ignoring the symptoms. I think that, PRP, really exciting natural treatment, and it really works. The laser really works, but I think what works is having an honest conversation with the patient, in a space where they feel comfortable. A lot of patients, like I had a woman in my office the other day who was telling me, I have been complaining and worrying about being able to have intercourse with my husband for years, but I've never, ever felt like it was a space where I could talk about it until now. And I think that patients need to talk to somebody who knows what they're talking about, because a lot of times it's a topic that is not well studied and not well versed and not well discussed. So just, make sure that women go somewhere or get information and go to the physician and say, this is what I'm interested in, and then go from there. But there's exciting technologies, and PRP women are always associated with sort of aesthetics, but there's real therapy of, therapeutic indications for it. My knee was amazing, faces aesthetics, but for vulvar vaginal health, it's almost life-changing for women.
Can any of those treatments help with prolapse like with a prolapse as well?
So the laser does not, but PRP is showing promise because amongst all of the other things, it helps strengthen tissue. It does help with laxity. Therefore, it should help with prolapse. Not prolapse, where the vagina comes right out or the uterus comes right out, but certainly mild degrees of prolapse, absolutely.
And you do surgery as well, right? So you're
No, not anymore.
Not anymore. Okay. So you're not practicing anymore with surgery. Okay. So having been an infertility doctor, which is where I mentioned earlier how we met.
Yes.
Do you notice anything from an infertility standpoint correlated to women who are in menopause? Is there anything that you're like, oh, I've noticed that women who have had infertility issues see this more often in menopause, or anything in terms of like the data? I don't know if, over the years you've been doing this for so long that you can make some type of correlation. I mean, I know for myself, I had PCOS. So we know that there's a correlation between blood sugar and, polycystic ovarian syndrome and some of the certain symptoms that we may experience. But I would love to hear your opinion from all the years of, you being in practice, if you've seen anything.
Just call me old.
No, not old, just very, experienced.
So that's a great question. And I think that a lot of times it depends on why the fertility was there. Yeah. So good public service announcement. Women who go through menopause early, so women that I see in the fertility setting that have a low reserve of eggs or premature ovarian failure, so important for these women to be treated with hormone replacement or estrogen replacement therapy until the age where they should have gone through menopause, like in their 50s. So women who go through premature ovarian failure, so important to go on some form of estrogen replacement. Often I'll use a birth control pill, but this happened to their body long before its time, and going on estrogen will help with their quality of life. And it's not HRT like everyone worries about. It's actual, it's like if you have a low thyroid, we replace the thyroid. If we have low estrogen because of ovarian failure prematurely, you go on estrogen. And that part is super important, and I feel very passionate about that.
Okay.
Women with PCOS, so polycystic ovarian syndrome, we know not only is it a hormonal issue with ovarian dysfunction related to the pituitary, but it is a metabolic problem as well. So patients of mine who have PCOS, now we know about the risks, huge risk of lipid abnormalities and diabetes. So I will see patients, if I follow them through their perimenopause and menopause, with blood sugars and lipids. So the metabolic part often shows up later.
Yeah, I remember when you were treating me for infertility back when I was trying to get pregnant with Zach, is you wanted me to go on metformin. I remember. So this was like years ago, and I had done it my natural rate. That's why I love hearing you say the natural route, because you and I talked about this for, so many years. Yeah. And I remember I went on natural supplements to help with managing blood sugar. So I learned that from you so many years ago, that there was that connection.
Right. So we're finding more and more actually about the metabolic problems with PCOS. And so my as information changes, your practice should change. So now I'm being really careful. I always do fasting blood sugars. I look for insulin resistance and dyslipidemias, and there is a very large correlation. But back to your natural thing. So yes, metformin works really, really well for PCOS, but inositol powder, there's other sort of more natural methods of dealing with it. So thanks to you for that. In terms of like IVF, if a woman's gone through 1 or 2 cycles of IVF, I do not see any sort of problems down the road in menopause with women who've done sort of just unexplained infertility treatments. I think they approach menopause in a more non-hormonal path because they feel that they've been treated with hormones so often when they were younger that they're somewhat more afraid. But I don't see any higher risk of cancer or breast cancer or anything. I just see a different mindset.
Interesting.
Yeah.
Very interesting. And what about women who've had babies older, like me, who had Abby at 41? Anything in that respect?
No, not at all. I think that the discussions are different in many ways. You know, it always comes up. I was a fertility patient for so many years. Does that put me at risk? What should I worry about? But no, I don't see any other sort of diseases that come through.
Interesting. I mean, it's great to, you know, for me, especially just because I had a baby, I had one in my early 30s and then had one later in my 40s, all working with you really throughout the years, you know, in terms of cycle monitoring and looking. So I love to hear, you know, the data that we kind of have acquired over the years, I think is super interesting to me now that I'm in this space and kind of looking back.
I that's one of the things that I love about my practice too, is, you know, following patients through like their life cycle, right? And not only do you develop great relationships and closeness and bonding and be part of that family in a way, but it gives me a real window into, you know, what options, what happens, you know, what patients sort of where their mind goes as they get older and what they're comfortable doing. And there are differences. I think part of it may be the relationship I formed with patients more than other things, but PCOS, metabolic, early menopause, hormone replacement, which I don't like calling it hormones. I like calling it estrogen replacement.
Estrogen replacement, right? And I know you're a big proponent of it. You and I've had many discussions about it. So, and you know, in terms of helping. So, just before we finish today's conversation, let's talk a little bit about estrogen replacement or hormone replacement, like what your thoughts are and how it can help women when it comes to their vaginal health.
So when we talk about estrogen replacement and vaginal health, I think that there are 2 different things. So there's estrogen replacement, hormone replacement, which is, you know, 30 hours of a discussion versus estrogen. If the estrogen is local, like the estring or the Vagifem, there is really no risk to women in terms of the absorption of estrogen. I see maybe 1 patient a year who will use Vagifem and tell me that her breasts are sore, and I will actually have her stop it. But for the most part, there is no real absorption of estrogen, which is why I feel comfortable in giving patients Monday to Friday. And that's the problem, right? Patients present with urogenital atrophy because they don't have estrogen. So if you give it back, it's going to work. And it does for the most part. Now, I don't think that using Vagifem twice a week always works. And women with profound vaginal dryness often need sort of a boost. So they might get a laser treatment to sort of get the vagina on its way and then maintain it with Vagifem thereafter. And that's a great option. Women with lichen sclerosus or vestibular inflammation that we talked about from soaps and other things, they don't respond to estrogen replacement. So they have to go on other therapies. Women with bladder infections, estrogen replacement can be life-changing for them. And I think that the difference in being able to say, okay, treating my vagina locally is very different than sort of globally treating you with hormone replacement therapy. They're very different things. You do not need to, you know, back tag progesterone along with Vagifem. It's just sort of local treatment. The lining of the uterus doesn't change. There's no systemic effects from it. I was gonna make another public service announcement. Liners, well, a lot of women wear liners or pads or something just for small amounts of incontinence or to feel better. Really careful about pads. The other thing I'm really passionate about is using I don't know if I can say the brand name, but I will. Yes.
Yeah, go ahead. Is it organic? You're
Always
talking about
pads.
organic?
The
Oh,
always pads are like a nightmare for women. They should be taken off the market.
more.
They have
Always.
that plastic weave on
Yeah.
top of the pad that sort of keeps you dry, eats away at the skin around the vagina. And young girls who use it, I've had in the past, and I still see them, not as often, women, young girls who aren't able to have sex, who can't do pap smears. The pain is actually not, inside the vagina, it's at the entrance of the vagina from the pads. Because remember, when you wear pads, the pads sort of do a V, right? And they rub against the vagina. So it kills that skin. It causes irritation. They have years of pain and discomfort. And unless you tune in to the fact that it's these always pads, women will say something, it's worse after my period. And then they're unable to have sex. They're unable to use tampons. It goes on and on and on, forever causing pain. And please don't use always pads.
So here's what I'm going to say about that, which is very interesting. So I thought you were going to, so the pads that you want to use, for those of you who are listening, are organic. And the brand that I worked with for years was Nature Care. Like, to me,
Right.
and if you go back, so if you Google, this is kind of a fun thing for you, for all of you who are listening, Dr. Weisberg, do this, Google pads on fire on YouTube. So I did, this was years ago. I actually set fire to always pads and to Nature Care pads. And it literally had like, I don't know, it's over like 100 and something thousand views on YouTube. And it was an experiment we did in my backyard. And literally we showed how it literally, the always pads within seconds, like whoosh, right into flame. And it's because of the plastic and what it's, the materials and the chemicals it's made with, versus Nature Care's organic cotton. And it like literally.
Simmer. Yeah,
exactly. It was like nothing, right? Like it hardly went. So like, that's a fun tip, is from my days before Morphus, when I was at still have Naturally Savvy, but literally pads on fire on YouTube, Google it. But I 100% agree with you. Please, 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 organic tampons. If you're in peri, you're still having your periods, and organic pads from Nature Care is my brand that I recommend. And I think it's great, but I'm so happy to hear you say that. And, the other thing that's interesting, and I'd love your take on this. I remember when I was at the gym there, because I play basketball now once a week, and I laugh. I'm like, I need to wear pads, because literally like running up and down the court, I'm constantly peeing my pants. Like, it's just like, I look at my daughter, I play with my daughter, and we play in like an older women's league with kids. And I'm like, I cannot run around without like having a little bit of leak. It's just what it is. I've had 3 kids vaginally. And anyway, so women were telling me that they were using like these things that you put up your, I guess, I don't know, it stops the leakage for incontinence.
So
but it's
yeah,
like
you can get. So one of the problem with leakage is the way the anatomy changes. The bladder drops a little bit. So there is a product, and I don't even know if it's still on the market. It's like a tampon that goes in the vagina. It opens up like an umbrella.
Yes,
So it
that's what she was using.
blocks the urethra from leaking.
But I would think that would also might cause some issues because of maybe the materials it's made with. But I was just curious if you had.
Yeah, I don't think it does, because the vagina
Okay.
is sort of inert. It's not like as sensitive as the skin on the outside. Knix underwear are beautiful also.
Yes, I know.
They don't
exactly
cause any irritation, and but always pads. Andrea, it's sort of sad. I see young girls like at least once or twice a month in my practice, and I don't typically see young girls who come in with the referral is from the family doctor's vaginismus, unable to use a tampon, look for an abnormality, and 99.9% of the time it's always pads. It's just such a pet peeve to me.
And the good news is that it's so fixable. Like literally
So
switch to
fixable.
organic pads. Like it's such an easy
a little
fix,
bit of steroid cream for a couple months, getting rid of those pads.
Oh,
So
wow,
we can't,
interesting.
the skin around the vagina, we need to protect her.
Yeah, we need to protect her. Wow, that is fascinating. Thank you for sharing that. And I think a lot of women will be like, oh, wow, I didn't know that either. So that's
And I tell my patients, don't even finish what you have. I don't care that you bought it on sale. Like, just get rid of it.
And also all the perfumes and the dyes. I mean, we did, I wrote a book, which was, I'm just trying to remember, this was years ago, it was an ebook that we wrote, and we had the pads in it. And it was like, unjunking your shopping cart, I think it was at the time. And we talked about the ingredients that were in pads and tampons, and how there's loopholes that are allowed to be, anyways, it's.
I love the burning. I love the fire thing. I'm going to look at that.
Pads on fire. That's it. I'm telling you, it's got like, I don't know, hundreds.
Yeah, well, vagina's on fire if you use the wrong
It's like literally, it was, I mean, crazy. It was a very eye-opening experiment to do, by the way. And I was like, whoa, like literally within seconds, because it's all the materials. Anyways, it's the
Yeah,
chemicals, the materials that are in them. So I'm happy that you brought that to our attention, because I don't think many of us think about what we're using for personal, like, hygiene products, right? Personal
right.
hygiene products. And it's so important. So Nature Care, again, the brand that I love. All right. Well, that was really fun. So is there anything else before we go that we didn't cover that you want to mention and to share with our audience?
I think I've done my 2 public service announcements. I feel really happy about that. I think that women need to understand that our bodies change. We spend a lot of time, God willing, postmenopausally. I think that we need to, have a healthy vagina to feel good and have a healthy sex life if that's what you want, or at least to be able to feel comfortable down in the vulvar area. And I'm so happy that my sort of practice took me there, because I feel like I can make a huge difference for women.
So can you share what your practice, the name of your practice, how people can get in touch with you? Do you have a website?
Sure. So if you Google me, you'll get to a landing page that has First Steps Fertility, which is my fertility clinic, and FemRenew, which is my sort of vulvar vaginal area. But my office, you can call. You can leave a note on either website that comes actually directly to me, and we can set up an appointment. You don't need a referral to see me for like the PRP or the laser. Like, you can call me directly, and actually call me directly for fertility too. So I want to put myself out there and easy to access, and I'm happy to see anybody.
That's awesome. I will put all the information below too. And for those who don't live in Toronto, in Canada, where can, like, how do they find a doctor like you that they can
So
trust?
there's lots of websites, like especially in the US, PRP and vaginal health. There's actually, US has a plethora of women's health clinics, which just they don't hear. I mean, I have women who fly in from the Maritimes to see me for their every 6-month laser.
Wow.
And so there are really not a lot of clinics in Canada. There aren't sort of women clinics, or women or clinics that deal with this kind of thing. There's menopause clinics, there's a vulvar clinic, huge wait for them. So it's hard. It's hard, and I'm happy that I got there. I got there sort of a long-winded way when I stopped delivering babies and I started doing fertility. A lot of my gynecological patients were going through menopause, and vaginal health was at the forefront, and that's what led me to the laser and down this path.
Like me,
Like
patients that
you.
have been with you
Oh,
for
I'm
a
never
really
getting
long
rid of you.
time. Thank you. No, and I adore you as my doctor. So thank you so much for doing this. I am so grateful.
Thank you for having me, Andrea.
And I'll have you back. I will definitely have you
Okay,
back.
excellent.
Well, that was fun. Who knew 20 years ago when I met Dr. Weisberg that we would be having a conversation about vaginal health and menopause? If you enjoyed my interview, please share it, because the more you share shows you care. And please leave a review of Menopause Reimagined, because I'd love to hear what you think about our podcast. Thank you for spending the last 45 minutes or so with us. I am grateful, because I know there's a lot of other things you could be doing, but I am so thrilled that you spent it with me. I'll see you at the next interview.